Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1. Questions 1 to 12. You hear a GP talking to a patient named Mrs. Brown, who is experiencing symptoms related to osteoporosis. For questions 1 to 12, complete the notes with a word or short phrase that you hear.
Good morning, Mrs. Brown. How have you been feeling lately?
Well, to be honest, not great. I've been having a lot of back pain, and I'm worried because I seem to have lost some height.
That does sound concerning. These symptoms are common in women who are postmenopausal. The drop in estrogen can increase the risk of osteoporosis, which could explain your back pain and height loss. Have you had any falls recently?
No major falls, but I've noticed that I feel more unsteady on my feet lately.
It's important we address that. Even minor falls can lead to fractures when bones are weakened by osteoporosis. I'd recommend we do a bone density scan to confirm if osteoporosis is present.
I see. Is there anything I can do to improve my bone health?
Absolutely. Weight-bearing exercises, like walking or light resistance training, are beneficial. You'll also need to increase your calcium and vitamin D intake. Have you been taking any supplements?
I haven't been taking anything specific, but I try to drink milk regularly.
That's a good start, but we may need to prescribe calcium and vitamin D supplements to ensure you're getting enough. Additionally, there are medications available that slow down bone loss, like bisphosphonates.
Are there side effects I should be aware of?
Some people experience mild gastrointestinal discomfort, but most tolerate the medication well. We'll monitor your response closely if you decide to start the treatment.
Thank you, doctor. I'll do whatever it takes to feel better.
Extract 2. Questions 13 to 24. You hear a pediatrician talking to the mother of a 3-year-old child named Sam about his asthma symptoms. For questions 13 to 24, complete the notes with a word or short phrase that you hear.
Hello, Mrs. Johnson. How is Sam doing today?
He's been wheezing again, especially at night. I'm really worried because it seems to be getting worse.
Nighttime symptoms are quite common in young children with asthma. Do you notice if his breathing problems get worse after physical activity?
Yes, after running around at the playground, he starts coughing and wheezing. I try to keep him indoors when it's cold, but he loves playing outside.
It sounds like Sam's asthma might be triggered by exercise and cold weather. Do you have his inhaler with you at all times?
Yes, but it's a struggle to get him to use it properly. He doesn't like the taste, and it makes him upset.
I understand. Using a spacer with the inhaler can make it easier and more effective. It's also a good idea to avoid exposure to smoke and dust, as these can worsen his symptoms.
We try our best, but it's hard to control every environment he's in.
That's understandable. We may need to review his medication plan. I'll prescribe a long-acting bronchodilator in addition to the inhaler to help manage his symptoms better.
Will the new medication have any side effects?
There may be mild side effects, like a slightly increased heart rate, but we'll monitor him closely. If his symptoms don't improve, we can discuss seeing a specialist.
Thank you, doctor. I just want him to be able to play without struggling to breathe.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you will hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer, a B or C, which fits best according to what you hear. Question 25. You hear two nurses discussing the care plan for a patient recovering from surgery.
Mr. Taylor's vitals are stable, but he's still not tolerating solid food well.
We might need to keep him on a liquid diet for another day or two.
Agreed. I'll also monitor his fluid intake closely to ensure he stays hydrated.
And let's check with the dietitian to see if we can offer any additional supplements.
Good idea. We'll also let the doctor know if there are any further issues with his appetite.
Question 26. You hear two doctors discussing a patient's medication plan for hypertension.
His blood pressure readings have been fluctuating despite the beta blockers.
It could be due to poor adherence. We need to ask the pharmacist to review his medication history.
That makes sense. We'll also need to check if he's experiencing side effects that could be causing him to skip doses.
I'll recommend switching to a combination drug if we confirm poor adherence.
Question 27. You hear two pharmacists discussing a patient's prescriptions.
I noticed that Mrs. Lee is taking both aspirin and clopidogrel.
That's a standard dual therapy after stent placement, but we need to monitor her for signs of bleeding.
Agreed. I'll make a note to review her lab results regularly to keep track of her platelet count.
If there are any abnormal findings, we should notify the cardiologist immediately.
Question 28. You hear two physiotherapists discussing a patient's rehabilitation progress.
Mr. James is improving, but he's still hesitant to fully bear weight on his operated leg.
That's expected. Let's try pool therapy next week. It might give him more confidence.
Good idea. I'll schedule a session and see how he responds.
If he progresses well, we can gradually reintroduce weight-bearing exercises on land.
Question 29. You hear two doctors discussing a patient with chronic heart failure.
Mr. Smith hasn't shown much improvement despite the uptitration of his ACE inhibitors.
We could try adding a diuretic to relieve his fluid retention.
That might work, but we'll need to monitor his kidney function closely.
I'll also check if the pharmacist can adjust his medication schedule to optimize adherence.
Question 30. You hear a respiratory therapist and a nurse discussing a patient's oxygen therapy.
Mr. Johnson's oxygen saturation dropped to 88% last night.
We should switch him to a high-flow nasal cannula for more effective delivery.
Good idea. I'll also notify the doctor to see if we need to order an arterial blood gas test.
Yes, and we'll monitor his response to the change throughout the day.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear a cardiologist giving a presentation on lipid disorder treatment protocols for patients with high cholesterol.
Good afternoon, everyone. Today, we'll be reviewing the current protocols for managing lipid disorders, particularly focusing on patients with high LDL cholesterol levels. These disorders are a significant risk factor for cardiovascular disease, so it's crucial to initiate treatment early. The first line of treatment typically involves statins, which reduce cholesterol production in the liver. For patients with mildly elevated LDL levels, a moderate-intensity statin, such as atorvastatin or simvastatin, is usually effective. However, for those at high cardiovascular risk, such as patients with a history of myocardial infarction, we prescribe high-intensity statins like rosuvastatin or atorvastatin at higher doses. Despite the benefits, not all patients tolerate statins well. Common side effects include muscle pain, fatigue, and gastrointestinal discomfort. For patients who cannot tolerate statins, we often switch to ezetimibe, which reduces cholesterol absorption in the intestines. In cases where both statins and ezetimibe fail to achieve the target LDL levels, we consider PCSK9 inhibitors, such as evolocumab or alirocumab. These are highly effective but come with a higher cost and must be administered via injection. Due to their cost, these drugs are usually reserved for patients with familial hypercholesterolemia or those with extremely high LDL levels. Alongside pharmacological treatment, lifestyle interventions are essential. Patients should reduce their intake of saturated fats and trans fats and increase their consumption of fiber-rich foods. Regular exercise also plays a critical role in managing lipid disorders and improving cardiovascular outcomes. The goal is not just to lower cholesterol levels but to reduce the overall risk of heart disease. It's important to follow up with patients regularly to assess their response to treatment. Blood tests to monitor lipid profiles and liver function are crucial, especially in the initial stages of statin therapy. Adjustments to the treatment plan should be made based on individual responses and side effects.
Extract 2. Questions 37 to 42. You hear a nutritionist being interviewed about dietary recommendations for patients with high cholesterol.
Good morning, and thank you for joining us today. Can you tell us what dietary strategies you recommend for patients trying to manage high cholesterol?
Good morning. Of course. One of the first things I advise patients is to reduce their intake of saturated fats and trans fats, which are found in processed foods and red meats. These fats raise LDL cholesterol levels, which we want to keep as low as possible. In addition, I encourage patients to eat more foods rich in soluble fiber like oats, beans, and fruits. Soluble fiber helps reduce the absorption of cholesterol in the bloodstream. Incorporating omega-3 fatty acids, which are found in fish like salmon and mackerel, is also beneficial. Omega-3s don't lower LDL cholesterol directly, but help reduce triglycerides and inflammation.
That sounds like practical advice. Are there any common challenges patients face when following these recommendations?
Absolutely. One challenge is that many patients are not familiar with food labels, so they struggle to identify foods high in unhealthy fats. Education is key here. I also recommend using healthier oils, like olive oil or avocado oil, instead of butter or margarine.
What about portion control? How important is that?
Portion control is essential. Even healthy foods, when eaten in excess, can lead to weight gain, which negatively impacts cholesterol levels. I advise patients to focus on balanced meals and be mindful of portion sizes.
And how do you motivate patients to stick to these dietary changes?
I encourage small, sustainable changes rather than drastic diets. Celebrating small successes, like replacing sugary snacks with fruit or reducing red meat consumption, helps build long-term habits.
That is the end of the listening test. You now have 2 minutes to check your answers.
AVN Pharma Education.